Her story was that of disability, stigmatization, poverty and discrimination. At age 5, Betia was hit with 2-stroke attacks as a result of sickle cell. Due to poverty, her family couldn't afford the care she needed and was left to her fate. However, the plight of Betia is gradually changing. 3 times a week, Betia Amegavi visits the University of Ghana Medical Center for 3 different therapy sessions. She has appointment at the Speech and Audiology Unit, the Occupational Therapy Center, and the Physiotherapy Unit. This is the Paediatric Physiotherapy Center, and for close to 9 months, Jemima Edu has helped Betia to learn to walk again. According to Jemima, Project Betia started with work on her muscles.
On the first day of the assessment, her muscle tone had increased. Her knee joint was stiff, so there was a limitation in the movement of her left knee joint. Her left ankle joint too, there was stiffness in the joint. Foot was curving inwardly. First line of treatment, we started with some mobilizations for both her upper limbs and her lower limbs, and then for the joints, range of movement exercises for her joints were done.
Emanuela Ofe Ahinsan handles Betia at the Speech and Audiology Unit. She tells GBC News that from the initial assessment, Betia could only say a few words, and even that, one needed to be extremely close to actually hear what she is saying. She's using a mode of communication called picture exchange.
The system is actually believed to help the users speak. So it's not totally taking away her probability of learning the verbal language. It's just augmenting the fact that now she can't freely use the verbal aspect. So then we are giving her the non-verbal aspect, which research has actually shown that it helps. After using it for a while, the users are able to speak.
The Occupational Therapy Unit is where Betia receives the bulk of the therapeutic activities. She receives therapy to enable her to write, to minimize the drooling, identify objects, and organize tasks, sit and walk. Basically, to reactivate her developmental abilities.
So she had sickle cell with 2 different strokes, so one at the right and one at the left, if I can. One side, which was her left, was more spastic, so it was tight. Okay, so we had tightness at the elbow, at the shoulder, at the wrist, in the fingers, and then on the knee.
It has been 9 months of dedicated service on the part of these physiotherapy specialists at the University of Ghana Medical Center, and they are happy with the outcome.
So talking about her milestones and where we came from, we've been able to achieve a lot with her, and I think she's doing well. And hopefully she should get better and go and join her mates in school. Let's go. Good. Fawebra. Don't crisscross your leg. Betia, let's go, girl. Let's go. Good. Let's go.
It's a sense of achievement for you as a physiotherapist when you realize that your client has improved. Based on the therapy you've been doing for the client. It makes us happy when you see that, oh, my client is doing very well.
Meanwhile, all the physiotherapy Betia receives at the UGMC, including all other care, is gratis. This arrangement was arrived at as a result of an MOU between GBC News and the UGMC. Dr. Kwame Nimbuama is the medical director at the UGMC, and under whose watch Betia is getting all the support.
This is a child who basically has been neglected, from childhood. So a very typical case of sickle cell disease patient who has been neglected, no health care at all, to the extent that at that age of 10, 11, is literally paralyzed and cannot walk. So essentially, as a health institution, we thought that we should take it up and give this child some hope, despite the fact that the parents don't have what it takes to afford the care that can be given. So that is what inspired us to do that. And at University of Ghana Medical Center, we provide compassionate care, which is patient and family centered.
Dr. Buama is hopeful that the care Betia is receiving will give her a 360 turnaround in her medical condition and live a normal life.
This is somebody who is 14 years, who literally has not worked, for a long time because of the debilitating nature of her sickle cell disease. So this involves really caring for her medical conditions, for giving her therapy to be able to walk, and then for the skills that you can perform, with your hands and other things. Also, we call that occupational therapy. So she's having the medical care by a team of pediatricians who are taking care of that. And then the physiotherapy group are also helping her to be able to mobilize or to be able to walk, as it were. And then the occupational therapies are focusing on her fine motor skills. So that's the kind of comprehensive care that we are giving to her. The medical care involves, all the various investigations that you've mentioned, the MRIs, the CT scans, the various lab tests, and the rest. So that's what we are doing, and of course the medications that we are giving.
On the flip side, through donations from kind-hearted Ghanaians, the family has put up a new accommodation. Arrangements have been concluded to send 3 more siblings of Betia who dropped out of school due to financial hardship to join their sister Ruth in school when school reopens in January 2023. Mother of Betia, Faustina Amegavi, thanked the UGMC, the Ghana Broadcasting Corporation, the ARC Foundation, and the public. She, however, confessed that Betia turned 15 years on December 15, 2022. But due to Betia's medical condition and stigma, she was forced to say that Betia was 11 years old.
My daughter is 15 years now, but because of stigma, I said that she was 11 years old.
This is the current state of Betia Amegavi, a story we brought you some months ago. Thankfully, the Greater Accra Regional Hospital is hoping to perform its first stem cell transplant on her after treatment from the UGMC. Reporting for GBC News, Gifty Ajay, Accra.